Today I will discuss about radical cure of P. vivax and P. ovale malaria in G6PD deficient patients. So first I'll present a case. So 15 years old boy came with fever with chills and it was an intermittent fever daily in evening for last 3 days. So based on physical examination history and blood test, he was diagnosed as a case of P. vivax malaria. In Plasmodium vivax and Plasmodium ovale malaria, parasite is found in liver also as dormant hypnozoites beside the erythrocytic phase, the phase in the blood. Therefore, the radical cure of malaria in this case requires administration of combination therapy. That means blood stage treatment with chloroquine or artemisinin combination based therapy or etc. and liver stage treatment. So, which drug should we give for radical cure of P. vivax malaria? So, 8-aminoquinolines like primaquine and dafenoquine clear the intrahepatic hypnozoites of Plasmodium vivax and ovale and thus preventing the relapse. Since they can cause hemolysis in patient with G6PD deficiency, we should test for the same. Now, G6PD of this patient came low, 6.8 units, which was less than the normal. So, what should we do now? Dafenoquine is contraindicated in G6PD deficiency, but primaquine can be used depending on the level of G6PD deficiency. So, what will be the dose of primaquine? So, in any patient with mild G6PD deficiency, that is amount of G6PD enzyme in blood at 10 to 16% of the normal range, we can give 0.75 milligram of base per kg, but maximum dose would be 45 milligram once weekly for 8 weeks. But even this dose may cause hemolysis in some patients. So after the first dose, we should wait for 3 days and we should check his CBC and LFT liver function test to check for the bilirubin. But if the G6PD deficiency is very severe, that is less than 10% of the normal range of G6PD enzymes in blood, we cannot give primaquine. And at the end, I will just discuss about G6PD deficiency and P. falciparum malaria also. So in P. falciparum malaria, there is no liver stage. So we don't need to clear the hypnozoites in P. falciparum malaria. But primaquine is the only effective agent against gametocytes of P. falciparum, which will prevent the further transmission of falciparum malaria. And G6PD otherwise confers a relative resistance against highly lethal falciparum malaria. So in P. falciparum, if suppose a G6PD deficient patient gets P. falciparum malaria, he needs only a single small dose that is 0.25 milligram per kg of primaquine. Therefore, it is safe in G6PD deficient people and thus it can be given without even testing for the G6PD. Thank you.